It's the mental worst-case scenario visions you see every day. The staring off into space, the negative thoughts, the heavy breathing, the excessive tiredness, the shaky limbs, the anxiety. Close your eyes. Imagine a moment in your life where something made you anxious, where you felt your heart rate elevate, your mind felt foggy, where all you could do was sit there, stare in front of you, and see nothing. You couldn't move, your breathing got shallow or accelerated, you're paralyzed. You breathe harder to calm yourself down, but end up getting dizzy. It just won't end. You've just experienced an anxiety attack. Anxiety is something that everyone has experienced at least once in their life. Me, I started struggling with anxiety after joining the military, and I still struggle with it today. Anxiety can develop into something worse, so it's very important to inform people of it. There are many kinds and signs and symptoms of anxiety, but there are ways to treat people with anxiety. Today, I will be informing you of the 5 main types of anxiety, the signs and symptoms of anxiety, and the treatments of anxiety. But according to Brain and Behavior Research Foundation, BBR, the 5 most common types of anxiety are generalized anxiety disorder, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, and social anxiety disorder. According to the Anxiety and Depression Association of America, anxiety disorders are the most common mental illness in the U.S., affecting 40 million adults in the U.S. age 18 and older, or 18.1% of the population every year. Many people don't realize they have an anxiety disorder, and some don't develop one until later in life. I have generalized anxiety disorder. This disorder makes me think of the worst-case scenario for everything. It makes having strong relationships difficult and makes relaxing nearly impossible. I also have a slight obsessive-compulsive disorder. One of my kids' chores is to put up the dishes, but the problem I face is that he never seems to put them away exactly the way my OCD wants him to. According to the BBR Foundation, compulsions are repetitive behaviors people with OCD feel compelled to perform and attempt to control or decrease the anxiety created by the obsessions. When I was stationed at MacDill Air Force Base in Tampa, Florida, we had an active shooter scare. It was then I realized I had a panic disorder. At the time, my 4-year-old daughter was at daycare on base. We didn't know where the shooter was, and I had a panic attack because I thought she might be in danger. The BBR Foundation characterizes a panic disorder by sudden acts of terror, which is exactly what I felt. PTSD is found among many military veterans. Although it is very common in military members, it can also occur if you've experienced a traumatizing event such as 9/11. As you may have seen in movies, or personally if you know victims of PTSD, even the slightest memory of the event could cause panic attacks and even lashing out at people around you. Social anxiety disorder is more common, as most of us have experienced it at one point or another. Something as simple as going to the grocery store could set it off. The BBR Foundation defines social anxiety as an anxiety disorder characterized by overwhelming anxiety and excessive self-consciousness in every social situation. There are many kinds of anxiety disorders and millions of ways these disorders can flare up. The simplest of things could set a person off with any of these disorders. You can have multiple versions of these disorders, and some even simultaneously, but every single person has different signs and symptoms. There are an infinite number of signs and symptoms that could lead to an anxiety disorder. According to the Inner Revolution, many signs of anxiety are lack of focus, having no energy, nervousness, irritability, sweatiness, being fidgety, fear, restlessness. There can also be many other symptoms though, such as sleeping all day or not wanting to get out of bed. The Mayo Clinic lists the following as main reasons of anxiety: feeling nervous, restless, tense, having an increased heart rate, hyperventilation, sweating, trembling, feeling weak or tired, having trouble concentrating or thinking about anything other than the present worry, etc. You don't have to experience all these symptoms, nor do you have to experience them at the same time for it to indicate an anxiety disorder. For me, I start hyperventilating, sweating, and my heart rate increases. There are many different symptoms, and these symptoms are showed in a multitude of ways, but there are ways of treating these symptoms. There are ways to treat or aid in the treatment of anxiety. Many doctors will recommend therapy or medications to help treat your anxiety. There are, however, self-care options that can help you manage your anxiety but not completely get rid of it. According to Healthline, medical treatment may not be necessary for everyone. Lifestyle choices may be enough to cope with the symptoms. Simply staying healthy or getting enough sleep or even eating a healthier diet can help some people regulate their symptoms. Cutting things out of your diet or out of your routine known to be harmful to you can also help. You can speak with a therapist who can help you work through your anxiety as well. According to the Mayo Clinic, cognitive behavioral therapy, or CBT, is the most effective form of psychotherapy for anxiety disorders. Medications can also be prescribed by your doctor or psychiatrist. I found therapy to be the most helpful form of treatment. It helped me work through my issues and figure out the underlying cause of my anxiety. There are many kinds of treatments for anxiety disorders. You can choose what's best for you. Anxiety is a disease that affects millions of people every single day. There are 5 main types of anxiety, and there are many different signs and symptoms of anxiety and there are many treatments or ways to help anxiety disorder. Look around the room. If 40 million people in the US alone suffer from anxiety disorder, perhaps the person next to you has an anxiety disorder. Maybe you have an anxiety disorder. Therefore, it is important to be informed so that we can all be aware and treated. Being fully informed and knowledgeable of anxiety disorders, their signs and symptoms, and treatments available can help those who struggle with anxiety. Before I knew what my anxiety symptoms meant, I started a slow decline to depression. I knew something was wrong, but I wasn't sure what. So I did my own research and immediately came up with anxiety disorder. Remember these signs and symptoms, and if you come across someone who's experiencing them, refer them to the information you have learned. Be supportive and let them know they're not alone. I appreciate all of you very, very much.
Thank you.
For putting it together.
Thank you for letting us be your audience.
Thank you.
All right.